April marks National Donate Life Month, a time to encourage Americans to register as an organ, eye, and tissue donor and to honor those who have already helped save lives.
Mayo Clinic in Scottsdale performs more transplants than any hospital in the nation, with more than 800 organ transplants last year alone.
People travel from all over the world to access their care. Now, thanks to a special translator, they're helping save lives in an often underserved population. Fox 10's Stephanie Bennett has the story.
Hello. Oh, yeah, there.
Communication is everything, especially when it comes to your health. That's where Selena Thomas comes in. She grew up on the Navajo Nation and speaks fluent Navajo, also known as Dene.
A lot of patients are very intimidated, to come here. It's such a huge facility.
She's worked as a patient navigator, serving American Indians and Alaska Natives for about a year at the Mayo Clinic in Scottsdale. From their very first appointment, she helps translate and walk patients through every step of their care, helping with questions and even organizing the little things like transportation and accommodation. She said she's helped her own family translate her whole life.
My mom is no longer with us and my grandma is no longer with us, so I feel like this is something that she would be very proud, knowing that I'm continuing to do this for other patients and being able to help them understand their own health care needs.
But there can be a stigma with getting a transplant in their culture, something Thomas hopes to change.
I wouldn't say frowned upon, but it's not something that is accepted, I guess, to get a transplant because a deceased person's organ is coming into your body and that could cause imbalance. And that's something that requires ceremonies and different things like that. But with more knowledge and education, sometimes some patients are more they're having to weigh their options and they're having to decide what they want.
Thanks to that education, the Mayo Clinic has seen a sharp rise in Navajo patients coming to their hospital. Patients like Robert Monroe, who needed a kidney transplant.
Yeah, she's been a big help. If I don't understand it, I ask her, and then she would interpret for me. Like me, I didn't finish high school, and a lot of times I do what I can. I'd like to say thank you to the people that gave me the kidney, and they gave me a new life and a lot of things to look forward to.
Monroe made the 3-hour journey from the Navajo Nation several times to meet with his doctors. But that was nothing, he says, compared to the trips he'd take to dialysis. If the roads were washed out, it would take well over an hour to get to his local clinic. His wife, Jackie Johnson, would sell these homemade lollipops to pay for gas.
About 4 years, he was on dialysis for 4 years. Because when he went to dialysis 3 times a week, that really drained him. From dialysis, he couldn't drive home. I had to take him in, drive him home, but once he got home, he went to sleep. He would sleep the rest of the day.
After speaking with Selena Thomas, they were on the transplant list. Then, last August, they got the call. They had a match. His new kidney and the start of his new life was waiting.
It was at 10:30 that we got a call. They told him he can come down here by 3 o'clock. In the afternoon. After his surgery, he wanted to walk. And they kept telling him, no, you can't walk, you have to wait, get some rest. He said, I guess they helped him up and he walked around the nurse's station twice. And they couldn't believe it that he wanted to walk after his surgery. That was amazing.
For that operation, we don't take out their old kidneys, we put another kidney in. And that kidney provides enough kidney function to get them off dialysis.
Dr. Harbell says kidneys are the most common transplants they see, performing 499 last year alone.
Transplant is a huge impact on a person's life. The dramatic change from before transplant, sometimes on death's door, to almost back to a regular, normal life after transplant is something that's really rewarding to see. It's a privilege to be able to participate in that, and it's something that I look forward to every day.
Although Robert Monroe's English sounds perfect, he says he still struggles with certain words. Selena Thomas has made all the difference and made him feel more comfortable.
I say thank you. People here changed my life, and seems like I've been doing stuff that I've always wanted to do.
Never one to sit still, Monroe says he now has a lot to catch up on. He plans to work on his house as well as others, fixing roofs, electrical work, carpentry, as well as a couple cars he needs to fix up.
To have more energy, especially when I'm at home. I hardly sit down. I keep going, and then she has to stop and says, "Come inside, take a rest." And then I sit there for a little time, and then when she starts doing something, I'm out the door already.
Times when we talk about it, you know, we tear up. When we were coming down, we were tearing up about things. But you know, we're happy. He says, you know, I'm happy that I got the transplant. I get to live longer. And the grandson says that. He says, my Che, meaning Grandpa, he said, my Che's going to live forever because he has 3 kidneys.
More than 100,000 people are currently waiting for a life-saving transplant across the country. You can help by signing up with Donate Life. A link will be found on our website at fox10phoenix.com. At the Mayo Clinic in Scottsdale, Stephanie Bennett, Fox 10 News.